Hi, thank you for joining us. This morning's class, we're going to go through our foundation series. We'll go through it a little bit quickly. It's more of a review what's on some of the other videos. We're doing a bit of soft tissue work, plantar fascia series, shoulder rehabilitation exercises, back strengthening, and then we'll start our weightlifting, deadlifts, and chest pressing. And so we'll just start out with the massage ball like we normally do. So I always, want to make sure we pay attention to the pectoral muscles, the muscles in the chest, for a number of reasons. And one is when from sitting, often our shoulders get rolled in. We want to have good posture. That's true. Okay, so we're first just here. I'm in the door frame. It's better than the wall because you can have your head in a better angle. But just have your head relaxed and massage out just below the collarbone. So here in between the collarbone and first rib, there's a muscle called the subclavius below the clavicle. And that one often gets gummy and sticky, and that prevents us from moving our arms up overhead correctly. And next, if you lift the arm up like that, then you can go across here on the pectoral tendons around the edge, the head of the humerus, your upper arm bone, so your arm can move more smoothly in your rotator cuff. Okay, and now we'll switch to the other side, so just below the collarbone, and have the head turn away from the ball, head angle down. And lift the arm up, and at the edge of your underarm, around your humerus, the head of the humerus. So we're going to work on the feet more extensively in shortly, and so we'll just start right away on the floor. Now, a few areas we're going to focus on. First, we'll start rolling out your quads. The quads also get short and tight just from life and from sitting and activities. So, and then we'll work here along the edge of the base of the skull, okay? And then here at the top of the shoulder area here in your upper trapezius muscle, then down around the scapula. You can stand with your back to the wall to do that if you like to. I prefer to do this on the floor. So here on the floor, you're only going to need the massage ball for now, and a foam roller or a rolling pin, whatever you like to do. When we roll out the quads, some people don't like to lie down to do this. So you can sit in a chair and use your foam roller, or you can use even a broomstick or a rolling pin. But we want to roll out the front of the legs, the quadricep muscles. Okay, so I'm just using my small foam roller here. And we'll start with the right leg. Start just above the knee. And we're going to work our way up the quads up to the hip. And as you do that, you can turn your leg in different angles. So you're working more the inside, then the middle, and then more on the outside of the quads. For here, you're still on the front of the leg, not really on the iliotibial band on the side of the leg. And then when you come at the top, right at the front of the hip flexors, when they shorten, they lift your leg up. And then on the outside of the hip, your TFL, tensor fascia lata, that externally rotates your leg. Okay, now left leg just above the knee. And this will help break up adhesions and scar tissue that you might have. It's just acidity that builds up day after day. Clean up those tissues so they're healthier muscles, strong muscles. Okay, and rotate the leg in slightly different angles as you do that. If you find an area that's especially sore or thick and hardened, you might work into that a little longer. hip flexors, and then on the outside of the hip. Okay, and so next we're going to work on the back of the neck. So it's kind of hard to demonstrate this, but you put the ball right at the base of the skull. And if your neck is particularly stiff and hyperextended, that means too much arch, you might put the ball on a book. And here I would hold onto the ball, and you just want to move the ball along the base of the skull. And you don't have to really move your head. You might just hold in a few different places, having contact at the base of the skull. Then we'll switch to the other side. And again, many of us from sitting in computers, our heads, the skull shifts too far forward. And so these muscles get tight. They're trying to hold your skull back in place. Okay, and next we're going to put the ball here on the upper trapezius muscle at the base of the shoulder. Sorry, at the base of the neck. So here I'm starting on the left side. And you can just move a bit side to side. Or just hold. If you again find that it's hard and knotted, you can just hold with pressure or roll over it a few times. And then the shoulder blade. So if you have that arm up, we're going to work our way down along the edge of the shoulder blade. Here you might just hold again if it's, especially sensitive someplace. Or you can move a bit side to side. So here in the upper traps, the middle trapezius, and the rhomboids, and then down more in the lower trapezius, closer to the bottom of the shoulder blade. And then we'll switch to the other side. So first, just at the base of the neck and across on the upper traps. You might hold, or you can put some pressure. You can roll cross fiber. It might feel a bit stringy and gummy. Okay, and a little further down now along the edge of the shoulder blade, you'd like to actually feel the contact with the edge of the shoulder blade, not on top of the shoulder blade itself, but just at the end, at the edge. The scapular rotators attach. Okay, and down closer to the bottom corner on the lower trapezius muscle. Okay, from there we're going to work on the hips. So I'm going to start on the left side. So you just lift the hip up a little bit. So you have your femur leg bone, and then right at the top of the femur, we're going to put the ball right at that edge. And then straighten the leg and tip the hips up on top of it. And just work your way around the head of the femur. Just like we did earlier in your shoulder, same idea here in your hip. Going around that socket. Okay, and then we'll turn more toward the back and work your way toward the tailbone. So here we're digging out our glutes. Okay, and then in the middle at the back of the hips here, there's the sacrum. That's another bony wedge. So we'd like to put the ball at the edges of the sacrum. And the piriformis muscle attaches here that often compresses the sciatic nerve and causes pain down the legs. And so here again, you might just hold for a moment. Then move up a little higher and hold. Or if you want to, you roll across the glutes, that's all fine. And then when you come to your pelvic bone, so that's the iliac crest, you start turning toward the side where the glute tendons attach. And when you find a thick, hardened area, you can hold or just roll over it a few times. Okay, and now more directly on the side, so there's this curve corner of the hips. So you want to let the ball sit into that corner. And this will allow your legs and to move more proficiently. So now we'll switch to the other hip. Right hip lift up a little. Right leg straight. And then first just massaging around the head of the femur. And of course, this you can spend all day doing this to try to give yourself a little bit more relief, but we do need to do other things too, so we do this a little quickly. Okay, and now down around the bottom edge of the head of the femur. And now turning toward the tailbone, toward the back. So you're sculpting your glutes here, and work your way up along the piriformis muscle, and hold where it's a bit sore. We go up a little higher along the sacrum, and then up in the corner where the sacrum meets your pelvis. Okay, and then turning toward the side, following the edge of your iliac crest. So you're still in the glutes, not in the lower back here. Okay, and turning a bit more to the side. And let the ball just sit into those tight bands. Okay, from here, we're going to transition into working on the plantar fascia, or you working on feet and ankles. So I sometimes do, sometimes not. I wear these toe spacer things. I find them beneficial in that they force your toes apart so that you strengthen your arches more instead of just letting your toes get squished in your shoes. So that's why I use them, rather than they're not really, I would say, just a support, like you're wearing a brace, not that. They make your feet work harder. So first thing we're doing is with our feet, we're just going to flex and extend the toes. For this, you don't really move your ankles, you're just bending and straightening the toes, and try to get all of the toes to spread. Then next, forward and back, so flexing and extending the ankles, and you can also integrate the toes. And on another occasion, you can spend more time going through these. Now we're going to do circles with the ankles, just circle in, and again, let your toes spread. And other direction circles. Okay, and now from here, first, if you're sitting on the floor, you should have your hands a little behind you, fingers angled out. Don't let yourself sink down like that, and don't have your hands pointing back. That puts too much pressure on the inside of the rotator cuff. You can sit in a chair also to do what we just practiced. So next, we're going to work on the toes, separating them and moving them. So if you could take one foot, and you can do this sitting in a chair, but you go big toe, next toe, and just move them relative to each other. I like to hold on to the toe knuckle. So try not to let the toes bend with this. Keep the toes straight. So you're moving the attachments at your foot. Then next two toes, work your way down along your foot. Next two toes. And next two toes. Keep them separated as we bend. If it's painful to do that because the skin is tight, as you practice, the skin will become more pliable. And switch feet. So big toe and next toe. And next two toes. Next two toes. And next two toes. Okay, and from here, you can sit in a chair. Some people need to do that. We're going to move the big toe independently of the other toes. So you go all toes down, big toe lift. Then big toe down, other toes lift. Some people will need to hold on to the toes to do that. If you can stand up, that would be good. So we're finished with the ball for now. We'll use it again shortly though. So the feet go like this. Big toes down, other toes lift. Other toes down, big toes lift, and just try to alternate. You can do 1 foot at a time. And again, if you need to hold the toes down, that's fine. Just need to get our feet to move a little better and become stronger. Okay, so then next, And we'll just rock forward and back, keeping the toes spread, and it's baby toe to big toe. When you come back, big toe to baby toe. Okay, now keeping all the toes spread and just slightly bouncing on the heels gently. The toes stay down and heels up and down. Like this. Okay, so next I'm going to be just standing upright, and I'm going to get something that's called a soulmate. You can use a rolled up towel for this. Now we're going to lengthen and strengthen and to stretch the toes and the calves. Okay, so first, so you have this rolled up towel. You see only the toes are up. And then you step forward and back a few times. And then you just step forward and bend the toes and hold. So a lot of people, big toe knuckle gets very sore and stiff and, start getting bunions. If you have pain in the big toe, just, reduce the pressure onto it, but we do want that joint to bend. Okay, now we'll switch feet. Okay, so the toes are up and the foot is on the floor, and just stepping forward and back. And then lift the heel, keeping the knees straight. Make sure the hips are squared forward, that you don't twist your hips or knees. And do try to put pressure onto the big toe. And you see this will also spread the toes to help prevent them from overlapping. So next, the calves. So you bring the foot up this time, only heel down. And then you can again step forward and back a few times. Okay, and then step forward. And if it works for you, you can walk the front foot around a little. Keep the back knees straight. So here you'll feel stretching calves, ankles. Some people will feel it more on the ankles, some people inside of shin, some people back of calf. Okay, then we'll switch. So foot up, and then step forward and back. Okay, and then step the foot around. Keep the back knees straight as you do that. We're just holding that stretch. Keep the big toe down, don't let your foot roll out. But at the same time, you want to let the ankle go out a bit. Big toe down, ankle out a bit without twisting your knee. Especially on the driving foot, often that ankle becomes weak and drops in. Okay, step back and around. So next you might use your ball, or I like to use a rock, but I have the soulmate thing. And now we're just going to basically massage out or put pressure, break up the fascia in your foot. So you work on all different angles. You can just press the ball. Very importantly though, here in the forefoot, so right here between the second and third toe, there's supposed to be an arch there. For many people, that arch drops down, and then people get pain in the Morton's neuroma. So we want to actually wrap your forefoot around the ball. So here I've got that edge, I can get right into that arch. And we also have an arch here on the outside of the foot. We want to press, we want to rebuild that arch. For many of us, that arch has collapsed. And that part right here outside of foot, at the bottom of your foot is where we have the most concentrated amount of proprioceptors, that help you feel balanced. So if that arch is not working very well, if the nerve endings have died off, then you're not going to be able to, of course, have good balance and more likely to fall. Okay, so now after that, we're going to start working on a series of exercises for our shoulders. And here you'll need a wall. I'm going to kind of go over this quickly. If you want to look up the anatomy of the shoulders, I would suggest you try to do that. The rotator cuff. Many people have shoulder injuries from just sports and just life, have torn rotator cuffs. So we're working on rehabilitating our shoulder joints, the rotator cuff. The first one is like this. So external rotation, that's external rotation. This is external rotation. So you want to stand at the wall like this. The elbow is by the side. Don't let the elbow go back like that. So this, your arm, the humerus is vertical. And then we're going to just press the back of the wrist into the wall. So I'm going to start left arm. You're standing sideways to the wall. The back of the wrist is pressing into the wall. We're holding for 10 seconds, okay? So ready? Just make sure you're square forward and press the back of your wrist into the wall with force, but not straining. When we go through this, you should never strain with your neck or shoulders. You're just very deliberately trying to press the back of the wrist to strengthen your rotator cuff. Then we'll turn around, the right side, and just pressing the back of the hand, the back of the wrist. The muscles we're working here are the infraspinatus and teres minor predominantly. Okay, and now rest. Okay, so next muscle is called the supraspinatus. So up on top here is upper trapezius. Underneath the upper trapezius is supraspinatus. The supraspinatus controls the shoulder blade and helps prevent it from going up like that. When supraspinatus is weak, we're like this all the time, and a lot of us have that problem. The way to do this is a bookshelf. So you'll have to find something in your house. I usually do this in the kitchen where I have a cupboard. The bookshelves are really good. And I'm just going to use a hook that I have on the wall. We're going a 10-second hold. So again, the action is you're pushing up with the back of your wrist, ideally under the bookshelf. But the angle, this is 0 degrees. For supraspinatus, you need to go out to 20 degrees. So arm is not here, arm is like this. So we're starting left arm. Your body is facing forward, you're facing the bookshelf. You have the wrist under the shelf. So you start with the arm at 0 degrees, then take it out to what's about a 20-degree angle and push up. Keep the shoulder down from the ear as you push up and keep your body straight forward. Don't let yourself twist your head. Don't let your hips shift to the side. Avoid using your quads. You can use your glutes a little more, but try not to tighten up your knees, your legs. Okay, now the right arm. Okay, so you start at arm is at 0 degrees, then you angle it out at 20 degrees, standing square forward and press up. Hold. Keep the elbow straight. Make sure, don't bend your elbow. Keep your arm straight. Fine. Okay, now subscapularis muscle. We have shoulder blade and rib cage. In between them is a muscle called the subscap. When it's strong and in good condition, your shoulder blade and rib cage move like this, like they stay together. They're like sandwiched in. When the subscap is weak, and overstretching often does that, or if you've torn your shoulders, that the shoulder blade pulls off the rib cage, the winging out. So to strengthen the subscapularis, the exercise goes like this. You bring your hand like this, like in your back pocket, and you want to push your hand in toward the wall. So we stand with back to wall, starting with left arm. Try not to lean. You are against the wall, I agree, but don't push your body into the wall. You're just standing upright. Left hand in the back pocket idea, and press your hand, not elbow. Try to press the palm of your hand into the wall. Most people will feel this around the front of the shoulder, so this will strengthen your rotator cuff. But, and some will notice switch arms. Okay, right hand behind, hand kind of in back pocket, and push back. Keep the chin in. Some people will notice like one shoulder blade really sticks out, the other one is not. But if you keep practicing this series over time, it'll help even out and rebuild your shoulder girdle. Okay, this is great. So next we're going to transition. So ideally you go through that series 4 times what we just did. But I'd like to go through all the foundation today. So next series is back strengthening. Here we have 4 exercises. Ideally, you'll have a big stability ball or an Ottoman. So I'm just going to set up here. An Ottoman, something like a big footrest, one of those cushiony footrests are really good. If you happen to have a weightlifting bench, you can do the torso lift a little differently. So I have this weightlifting bench. So I'm just going to assume everybody has some of that equipment, and I'm going to just demonstrate these. On other videos, I've demonstrated the bird dog option. So if you're familiar, you can, and you don't have an Ottoman, you can do the bird dog, right arm, left leg lift, left arm, right leg lift. Okay, so on the Ottoman, this is really important. When you do the torso lifting, this is the first exercise we'll be doing for the back. So when you start out, your feet will be on the floor and hands at lower back like this. And you don't want to hyperextend your back. So in the relaxed position is maybe here. And when you lift, you think of bracing your back and only lift to here before your back starts cramping up and overarching. It somewhat depends upon how high your Ottoman or your ball is. When we do the leg lifts, your arms ideally should be straight, not like that. So you might have to take the hands a bit wider like this. And we go like this, 2 legs lift. And always you brace your lower back and lift and hold. And don't lift the legs too high. If you lift your legs too high, again, you'll feel the lower back cramping. So it shouldn't be a cramping sensation in the low back. It should feel like a brace. You can always imagine someone putting a heavy plate on your back. That's what it would feel like. Okay, so first is the torso lift. So if you could go on the Ottoman, hands at the lower back, keep the chin tucked in. We're going to do 10-second holds 2 times. If you have a bench, you would have the chin down and you don't lift the legs, you lift the arms. Okay, everybody ready? Think of bracing the lower back, hands at lower back, and then torso lift and hold without cramping the lower back. The people on the bench, you instead don't lift the torso, you lift the arms. Everybody rest. Okay, then we're doing exactly the same again, the torso lift, the chin in, brace the lower back, and lift, hold. Okay, and rest. This series that we're doing at this moment is to strengthen the multifidi muscles that hold the spine together. So now we go still on the Ottoman, the double leg lift. So you take the hands a little more forward. The feet are together. Brace your abs, tuck your chin, engage the glutes, brace your lower back, and lift both legs together. Keep engaging the glutes and engaging your abs. Your lower back shouldn't sag. And legs down, shoulders down from the ears. Keep looking straight down into the floor. Brace your lower back and lift the legs. Hold. Maintain that brace. And lower. Then walk the hands back. To get off, you walk the hands back, then move back, then come with elbows on the Ottoman or your ball, chin in, then lift both knees so that you don't twist your knees as you're getting up. Okay, now we are going to push-up position. You can use your Ottoman again, or here I have this bench. So you can have your hands like this. If your wrists are sore, you can go like this on the fists. Okay, we're just going into a good plank position. Or you can go flat hands. The way to get in position is you set the arms, walk the feet back. Okay, you're on the toes, and then hinge forward with straight arms, hold, shoulders down from the ears. Brace your abs and glutes. Make sure you don't let your head drop down. Now keep your arms and legs straight. Don't bend knees and elbows. Walk the toes forward incrementally, inchworm your way up. All right, that's excellent. Okay, we're doing that again. If you have your hands flat, you can bend your elbows a bit. So here we go, second time, you walk the feet back. And then hinge forward. Now, if you want to, like I said, you can bend the elbows a bit here, lower push-up position. But don't let your head go forward. No sagging lower back. Okay, if your elbows are bent, you straighten. Keep your arms and knees straight and walk the toes forward. And rest. Okay, so what we've just done, ideally for a complete back strengthening series, you would do that 3 or 4 times through. And for now, we're going to next go into our weightlifting. And I like to include deadlifts in almost every session because it's a very simple way and also really beneficial way to improve your full body strength and bone density. So this, you will use a heavier weight if you have that option. And in our classes, I generally like to do multiple angles and to create more of a rotational force so that you strengthen, you know, when you're walking, you like twist your ankle a bit and the knee will twist a little. So when we're training, if we do these angles, our joints will be able to tolerate those kind of forces. Okay, so first, sorry, I just have to plug this in. Okay, so we'll just quickly go over the hip hinging aspect of the deadlift. So if you would just have your feet hip width apart, standing really tall, and the chin is not down like that, and not forward, but pulled horizontally back, and feel like someone's pulling you up from the top of your head, so you're standing really tall. You should immediately feel your abs are engaged. Put the hands on your thighs. Keep your elbows straight the entire time. Soft knees, and then don't bend your knees yet, but push your hips back so you're hinging at the hips. Keep your hands on your legs and keep the arms straight. And then start bending the knees a little, and you can wrap your hands around the knees. Keep the chin in though, don't let your head go forward. Okay, so from here, so now you're in your hip hinge position, think of really engaging the glutes, keep the abs braced, and slowly keep your arms straight as you stand. And at the top, stand really tall and squeeze your glutes together from the sides. Chin in, we'll do it once more. Just keep your arms straight, slide the hips back. Keep the chin in. Wrap the hands around the knees, like a shortstop position. Okay, keep your arms straight, engage your glutes, and hip hinge up. Okay, for our set today, we're going to have the feet just a little wider than hips. Both hands holding on. We're going to do a set of 20. Okay, so just standing really tall. Keep the chin tucked in, exactly as we practiced. Keep the legs straight at first, push the hips back. When the hands get just a little above the knees, then you hip hinge, or let the knees flex a bit. And just keep practicing that hip hinge action. Okay, and rest. Okay. Perfect. And now we'll just walk a little forward and backwards. Okay, so now to work more of the hip internal, external rotators, and also the inside and outside of the knees. Now we'll take a wider stance to strengthen shoulder rotation, external rotation. We use one arm, palm face forward. Okay, left hand holding on. Palm is facing forward, chin back. Same action, push the hips back, hip hinge back. And then at the bottom, think of squeezing the glutes to stand up. From the sides of the hips, like a pair of pliers, squeezing the sides of your hips together. And rest. Okay, and now we're switching right away to the other hand. Palm is facing forward. Avoid leaning down to that side. Keep the body centered. Chin in, hip hinge. And imagine these giant pliers squeezing your glutes together from the sides. And rest. Perfect. And then just walking a little forward and backwards. Okay, last step, we're going to pay more attention to the feet. Okay, the feet a little wider than hips. All the toes are pressing into the floor. Hip hinge, so both hands hold on, standing really tall. This time, as you're standing, think of pushing the feet through the floor. Chin in, brace your lower back and abs, push the hips back, then press the feet through the floor, stand all the way up. And rest. Perfect. Okay, now we'll put the weight down. Okay, so today for the upper body component of our training, we're going to do chest pressing. And we'll just do one arm chest press. You can do this lying down on the floor. If you happen to have a weightlifting bench, you might use that here, or you can even lie on the couch if you want to. So to develop more of the rotational aspect of the exercise, there's a particular way that you would lie down on the bench. And you just need to be sure that you're set up at a good angle. So why I'm doing this angle is, as I said, that you have better rotational core application. So we're going to do only one arm. You're at home, and we'll be doing sets of 15. So whatever might be an appropriate weight. Sometimes I will use a dumbbell, sometimes a kettlebell. Just a couple of things to pay attention to. The elbow, when you bring your elbow to the floor, the elbow will be at about a 45-degree angle, and then as you push straight up, the weight will stay directly over the elbow. And that when you're setting your wrist angle, often people let the wrist kind of bend back like that. So the wrist should always be straight. Don't let the wrist hyperextend. Okay, so we're starting with left arm pressing. We'll be doing 3 sets of 15. Right leg is bent and left leg is straight if you're on the floor. If you're on the bench, you're kind of on just the side of the bench, the way I am, right leg up, left foot on the floor. Okay, then left elbow down to the floor and press. The elbow, when you come down, should be at about a 45-degree angle. That's the most comfortable position for the angle of the shoulder blade and the rotator cuff. Okay, and then we'll switch. So right hand, right leg straight and left leg bend. So that offset position forces your rotational core to activate. Keep the chin in. So don't let the chin go up to the sky. You can put something under your head if you need to. Right elbow, 45-degree angle, and press. Okay, switch sides. Okay, now the humerus, that's the upper arm bone. So, or think the back of your shoulder. Left arm up, right leg is bent, left leg is straight. When you bring the elbow down, bring the shoulder back into the floor. Keep the shoulder back into the floor as you straighten the arm. Don't let your shoulder lift up off the floor. Be aware of that shoulder, don't pop it out of the rotator cuff. Or don't let the humerus lift up out of the rotator cuff. You want to hold your arm in the rotator cuff socket. Okay, and switch sides. Right leg is straight and left leg is bent. Chin down. Brace your abs always, but don't flatten the lower back to the floor. You should have a slight arch in the lower back. Okay, bring the elbow down. Make sure the shoulder is back into the floor and press. And as you straighten the arm, don't roll the shoulder up. Okay, and now switching, left hand, right foot up, left leg down. Okay, the breathing is that you exhale as you push up, chin in, bring the elbow to the floor, shoulder back, exhale, press. Rest, right arm, right leg is straight, left leg is bent. Okay, chin in, shoulders are level, right elbow down. Okay, shoulder back to the floor, exhale, press. And rest. Okay, great. So now we'll put the weight down and we're going to next transition into hip strengthening, hip internal and external rotators. So I have other videos that demonstrate the repetitions when we do a sets with reps. Today we're going to do only holds. So we're not going to go up, down, multiple times. We're going to be doing 10-second holds to build up the resilience and help more in the repair of our damaged hips, and hopefully will be good and they will never be damaged. Okay. Okay. So I'm going to sit. If you don't have an option like a couch or bed, couch would be better than bed. But regardless, if you don't have that option, you can just lie on the floor. The reason is we're going to do external and internal rotation. So that means external is when this top leg is glutes are engaged, glute med engaged, and you lift up like that. That's external. You can rotate a bit like this. Internal is like this. I'll go over it again, but this is internal rotators. Okay, so this is why it's better to be on a couch or a bench or something like a bed. Okay, so I'd like to start with the left leg. Now, please, it's really critical that you're set up correctly so you don't twist at your waist or twist your neck or shoulders. So your head should be supported however you like. The shoulders should be vertically stacked and the hips vertically stacked. Don't lean back. The knees here, the knees are bent 90-degree angle, or sorry, a 45-degree angle. And then you keep the knees vertically on top of each other and straighten the top leg in front. Keep the top leg flexed. And we're just going to stay there. We're going to hold for 10 seconds. And here you should be using your hip external rotator muscles like gluteus medius, piriformis, obturator, internus. Okay, and then when you lift, so you can just lift, keeping, again, the knees are more like vertically on top of each other, really. And if you like to, as you do that, you can externally rotate the femur. Don't use your IT band too much. You should feel it on the outside of the hip. So if you can't do that rotation, forget it, just lift the leg. But that's the external rotation of your femur in your hip joint. Okay, leg down. So now we're going to switch sides. Why I like doing these holds, it really helps to build the stability of the joints. You know, you can move around a lot, walk, but the hips are unstable and they're not strong enough. So this will build up the strength and stabilization component and allow enough time for repair. For the second one, what you do is you start again, same position, then straighten the top leg straight down, the foot is flexed. The bottom leg, bring the bottom of the leg forward, okay? Keep the hips on top of each other, don't lean back. And keep the knee always in front of the hip. Don't move the knee up and down. You're not moving your leg up and down. You're rotating your femur in your hip joint. So now this is internally rotated hip. My femur is internally rotated when the leg is down. And then we're going to use our adductors and hold. Always keep a 90-degree angle at your knee. And knee doesn't go up and down. Knee is always directly in front of hip joint. Foot flex. Try not to twist the ankle. Okay, now put the knees on top of each other again. We're switching. Top leg forward. Hold. Lift, externally rotate. You don't have to rotate out, but if you can do that, you should feel it kind of pinching on the outside of your hip at the top of the femur. Piriformis and gluteus medius. Okay, leg down. So now we're going to continue that cycle. So we'll switch to the other side. Okay, knees on top of each other. Straighten the top leg, foot is flexed. Hold. Okay, and then you can just lift the leg, or you can try to externally rotate as you lift. You don't need to lift high, like a 45-degree angle is optimal. And don't bend your knee. You shouldn't feel it in your quads. You should feel it in the outside of the hip. And we'll lower the leg. Okay, knees on top of each other, top leg straighten, bottom leg, the lower leg goes forward, and then drop the foot down, keeping the knee in front of the hip. And rotate up and hold. So you keep that 90-degree at the knee. Okay, and down. And then we'll switch again. Okay, so here we're going to start with top leg straight and do the internal rotation, lower leg down, and hold, keeping the foot flexed. And when you lift, you're not lifting your leg up, but you're rotating your femur in your hip joint, and the foot comes up. Okay, and then bend the knees on top of each other, and top leg forward, straighten and hold. Foot is flexed. And externally rotate and hold. Okay, and leg down. All right, and then we'll just stand up and walk a bit. That series as well, you know, you might go through that 4 times for getting more comprehensive training for the hips. But what you'll notice, okay, after doing that work on your hips, if you walk, you can feel that there's more freedom of your hips. And if you walk in different directions, you'll have more activation. You'll just, over time with regular practice, you'll feel much stronger. Additionally, with the shoulders, so if you just like lift one arm up like this, and then other arm up, and just move the arms around a little, okay, they should feel a lot better from the rotator cuff work we did earlier. So thanks for joining me, and I hope to see you next time. Have a great day.